Way back in 1950, the year the Oregon Healthcare Association was founded, this was one of America's favorite TV shows.
Are you still there?
In the decades since, like that enduring television icon, Oregon's long-term care providers have led the nation on a heroic and sometimes difficult quest to provide better care for America's seniors.
Those challenges really only make us better.
The values that got you this far are going to carry you through to the end.
As long as change means that our patients, our residents get better care, bring it on.
Oregon is almost always at the forefront. If you were to look back over the past 65 years and all the challenges and all the opportunities and all the things that have been achieved, to the credit of a lot of those pioneers, they saw the opportunity that presented itself to deliver services in different, new, and innovative fashions.
Oregon has been a leader. It's just our pioneer spirit.
My grandparents started a little nursing home in Grants Pass, Oregon in 1943. And they had 6 residents. My grandmother gave the care and my granddad did the maintenance. They were definitely pioneers. In the evenings, they would sit around and talk about what can we do to improve and give better care. During that time, most of the seniors were cared in what was called the county home. So each county would have a large facility, and those people that didn't have family to take care of them would go to the county home. And so this little nursing home was one of the first kind of entrepreneurial excursions into that field.
Well, it all began with my grandmother, Sarah Delamarter, who was a licensed practical nurse.
Around 1945, she and my father went out on a limb and took a $16,000 loan on a house in Wood Village. She furnished the meals, she gave them their medications, she did the laundry, and she kind of ran the place 24 hours. It was not an easy task.
My grandmother was a very compassionate, caring person. She would sleep in a sleeping bag at the top of an open staircase so that if a resident wandered, they would get to her before they got to the steps.
This caregiving seemed to be natural for her.
I really think she was a pioneer in the business.
The Oregon Healthcare Association was created in 1950, and it's really quite remarkable that a group of individuals would come together at that point in time. Let's remember, that's 15 years before the advent of Medicaid and the Medicare program.
In the early days, there was very meager reimbursement for taking care of these people. I remember really distinctly when I was a little boy sitting in the living room listening to my grandmother call the governor, and she's saying, "Governor, necessary medications must be provided."
They obviously had challenges and things that they were facing and trying to meet the needs of individuals and communities, and they recognized that by coming together and associating themselves with one another, that they could be a stronger voice, a more powerful voice to make sure that people got the care that they need and that they could do a better job serving individuals and families in their community.
We formed Oregon Healthcare, and you see what it is today. I think the premier organization in the nation.
I'd say one of the prime examples of innovation here in Oregon was this is really the birthplace of assisted living.
Well, it started with my mom. My mother had a stroke and had some limitations on her ability to take care of herself. When I told her that I was going to become a gerontologist, she said, "Why don't you do something to help people like me?" The long-term care system in Oregon consisted of one choice, nursing home. And we literally sat around our dining room table, and I designed the place that my mother would like to be in.
Oregon became the home or the beginning of the assisted living model, which is now spread throughout the country, which we all recognize now as a far superior method to care for the elderly in a social setting as opposed to a medical setting.
Every time there's been a major shift, either in reimbursement or regulation, And there have been several. We come together and we do the right thing.
You know, I think the unknowns is actually the fun part for me, in the fact that you get to be creative and there's not a roadmap laid out for you. And so trying to find ways to chase the challenges and actually solve the problems where you're solving it for the staff, the family, and the residents.
When you look at the change our members have been confronted with in just the most recent years, with the Affordable Care Act, with new federal rules and regulations, with new state rules and regulations constantly coming down, oftentimes that are very prescriptive. Yet, throughout all of this, they're adapting, they're innovating, and they're doing a good job of keeping their eye on the ball, which is meeting the needs of people.
No matter what you get reimbursed for a patient, no matter what is required to provide, if you're not doing what's best for that patient, then you're not doing your job.
They've given their life to us and to their country and to their cities and to their world, and now it's our turn to give back. And that's what we get to do in long-term care.
It's just a privilege to take care of them. You know, at the end of the day, you made a difference in somebody's life.
I think there's just no greater happiness than being able to show love and kindness to other people.
There's something about when you walk down the hall and you see those residents that live there and their face lights up when they see you, that makes you feel like you can continue to do what you do.
I look back and I'm very happy that I got to be part of these people's lives.
I go back day after day because it is a job I love.
Looking back on our pioneers and really looking at the challenges that they've had to face, we really still have those same challenges where we are looking at how to be in compliance with our regulations, how to hire the best staff, how to train the best staff, and all at the end of the day, making the best quality of care that we can for residents.
Oregon Healthcare Association is a collection of providers, and what I really want to do is just take my hat off to them and thank them for the very important work that they do each and every day.
Now that we know where we've been and where we need to go, it's easier to really navigate that road.